Continuation, pharmacokinetics of Artemether lumefantrine. Lumefantrine is highly lipophilic, so oral absorption requires a high fatty diet. Absorption of Artemether is relatively rapid. Plasma level is achieved in about 2 hours, whereas the absorption of lumefantrine is delayed, and plasma levels is achieved between 6 to 8 hours. The half-life of Artemether here, just within 1 hour 30 minutes. The half-life is about 1 hour 30 minutes. Whereas the half-life of lumefantrine is 100 hours. This means that lumefantrine will stay longer in the body, many days or even weeks after Artemether has been cleared from the body. So from here, I want to talk about the reasons for combining Artemether and lumefantrine. Why do we combine them? That Artemether is much more effective, as most of the benefits comes from Artemether. From this combination of Artemether and lumefantrine, most of the benefit comes from Artemether, so it's much more effective. So we added lumefantrine because it helps to prevent the development of resistance to Artemether. So WHO in 2006 requested that all drug companies should stop selling artemisinin only products and replace them with artemisinin combination therapy. That's why that act came up, that drug companies should stop selling artemisinin based products because the half-life was just 1.5 hours rapid absorption. So to prevent resistance from developing and to ensure treatment was effective, it had to be combined with maybe lumefantrine or something else. So lumefantrine was added for that purpose. Adverse effects will include your headache, anorexia, dizziness, weakness, joint and muscle pain, etc., as experienced in at least 1/3 of users. Fever, cough, vomiting, anorexia, and headache are common adverse effects in children. So in children, fever, cough, vomiting, anorexia, headache are also common. Lumefantrine may prolong QT interval and should be avoided in patients with electrolyte disturbances. These are also issues we find with quinidine, quinine, and all of those, so that lumefantrine may prolong the QT interval. Artemether lumefantrine is classified in FDA pregnancy risk category C. So category C, Artemether lumefantrine are metabolized primarily by hepatic CYP3A4. Those are one of those liver enzymes. Lumefantrine inhibits CYP2D6, so it may raise level of the substrate. So they are metabolized by CYP3A4, and lumefantrine will inhibit CYP2D6. Preparation and dose. Artemether lumefantrine is supplied in tablet that contains 20 mg Artemether and 120 mg lumefantrine. So one course of treatment consists of 6 doses, right? The first 2 are taken 8 hours apart. The other 2 are taken BD for the next 2 days. So, and based on the body weight, the drug are taken for an adult. Adult will take 4 tablets of 20 by 120 mg, right? BD. The first one will be 6 hours, 8 hours apart. Then for the other 2 days, it will be BD. So the other drug there is artesunate. So artesunate is also a derivative of what? Artemisinin. And its malaria action is similar to that of Artemether. So at the time, artesunate administered IV is considered the drug of choice for severe malaria. So whereas we could not use artemisinin, Artemether for severe malaria, here at the time, artesunate was used given IV for severe malaria. It appears to be more effective than IV quinine and safer than IV quinidine. That was why it was given. The recommended regimen is 4 doses, 2.4 mg per kg each, administered at 0, 12, 24, and 40. That is the first day. That will be like 3 doses: 0, 12, and 24. Then 48 hours. 0 and 12 will be the first day. 24 hours will be the next day. 48 hours will be the third day. To enhance efficacy and minimize development of resistance, dosing with an oral drug, e.g., doxycycline, clindamycin, or mefloquine should begin as soon as possible. So artesunate can be used for severe malaria, and whereas Artemether could not be given. So thank you. Let's stop the video there.